oh, I can stand up. And so she did that,
Wow.
sitting down and standing up. She said, oh my goodness. She said, I've not been able to do that without help and support for
I was
months.
just gonna, I was gonna add too. I think it's really important. It's not only the tool, but it's the practitioner. So, and so, like, I know that the two of you are very popular. Like the clients really actually like going to see you guys personally. You put it in my hands. First of all, I don't know what I'm doing, and I'm not really, I don't want to touch people. I'm a wellness practitioner, but I'm doing things where I don't have to touch anybody. So I think, you want to go to a practitioner that of course has some experience, proven experience, is very comfortable in dealing with people, is sincere, right? So they're genuinely connected and trying to understand what's going on with the client. Hey everyone, this is Victor again, and today I'm with Dr. Holst and with Dr. Diego, two chiropractors, and you guys have probably seen me with Dr. Diego before, and he's actually taking over from Dr. Holtz, who's going into kind of a semi-retirement, but we hope to continue seeing him. And he's the one that actually established the Middletown Health and Wellness Chiropractic uh, place that we're actually running out of now. So nice to see you again, Dr. Holst.
Nice to be seen.
Yeah, absolutely. So I wanted to ask you a bunch of stuff about the background, like how long has this chiropractic center been here in Middletown? Um, how long ago was it? I know you've been here a long time, or you were here a long time.
Yeah, I was there a long time. So doors officially opened December 27th, 1986. We were down the road about a mile and a half when we started, a little tiny office. And then by April of 1990, we moved into the existing facility that we have now. So yeah, it's been um, 30 some odd years. Yeah.
Well, yeah, it's been a long, long time.
We started as Holst Chiropractic, and then I think it was about 4 years ago, we switched over to Middletown Health, Wellness, and Chiropractic.
Oh, okay, so that's pretty recent then.
Yeah.
Okay. Oh, okay, cool. Well, very good. And then you and Dr. Diego he's actually started working for you. Were you looking for someone to help you move into a semi-retirement position?
Yeah, I've known Dr. Diego, I don't know, what is it, 5 or 6 years now. I remember him popping in the office, introduced himself to me um, back then, and I always thought him to be a energetic, young, entrepreneurial type of guy, and lo and behold, here it is, 4 or 5 years later. He's getting ready to sit in my seat there at the office. It's been awesome. I'm
Yeah,
excited.
it's a privilege. It's a privilege.
Yeah.
Nice, nice. That is a pretty nice office, by the way.
Yeah.
I mean, your particular room in the right, because there's like 5 rooms, and it's a nice setup here. Yeah, it's a
Oh,
nice location.
there's been a couple of iterations of the office. When I first started, there was a little bit different design. We had 5 treatment rooms, um, each about the same. I had an X-ray machine, um, and then over the years, we changed to a multidiscipline practice. So that changed the whole footprint or shape in the office, and and then after 2 or 3 years of that, I got itchy to get back into just being a regular chiropractor again. So we
Mm,
switched the office back to chiropractic only, um, and it's been wonderful ever since. Yeah,
nice, nice. Yeah,
And
and
then you got
actually,
into Softwave.
Softwave
yes.
came in 3 years ago. Yeah, I was
Yeah.
excited about that. I was excited about getting it in. I was
Mhm.
excited about the opportunity to help it to heal my knee. I mean, that was the reason I investigated Softwave to begin with. Um, and yeah, I came in the office August of 3 years ago. What's that? So 21.
Nice. So it was your personal experience with Softwave is what made you get behind it and start using it for your clients?
Absolutely. So it was 20 years in the development where my knee would bother me every now and again. During that time, by the time I thought about calling somebody, the pain went away. And I said, you know what? I'm safe for now. But 4 years ago, it became constant. I couldn't sleep. I couldn't sit. And I
Oh,
couldn't go up
wow.
and down the stairs. Um, Went to the orthopedist. Orthopedist took an x-ray, had bone-on-bone degeneration.
Oh,
None of their injections work. I had cortisone. I had the gel. And I got little to no relief out of any of that. And so my last conversation with him was him telling me, Well, you got bone on bone, you got 2 options. You either gotta learn to live with it or you get a total knee replacement. And I said, "You know what? I'm an original equipment sort of guy. I
Mm.
like what God gave me. The thought of someone cutting me out and throwing it in the garbage does not appeal to me. I need to do some research first," and that's when I discovered Softwave.
Nice,
And
nice.
it's been a game changer since.
It's been huge. Not
Mm.
only for me, now I can sit, sleep, and go up and down the stairs. But in the office there, we've treated everybody from TMJ issues right down to plantar fasciitis and even turf toe and everything in between. So what I tell patients now is if it's a bone, muscle, ligament, or joint, and it's got an itis after it, um, bursitis, arthritis, that's inflammation, and Softwave will help it.
And we're
Nice,
getting
nice.
great results from patients. A lot of great feedback.
Yeah,
The,
Mm.
the efficacy is actually really high.
it's very high. It's and in my 40 years of being in this industry, I've done it all. I've done electrical stim, varying types, various types of electrical stim. I've done ultrasound. And we even had a laser machine in the office for a
Mm,
period of time. Nothing works to heal the tissue like Softwave.
right. You guys had PEMF, you had a PEMF mat in here too, right? At one
Yep,
point?
yep,
Yep, yep.
yeah,
So,
we've
yeah,
had that. It's fun. It provides some odd adjunct type of healing,
mm,
but again, nothing works really quite as
mm,
effective and as quickly as
right.
soft.
Well, I'm
Now,
seeing it
patients
too.
actually can see results immediately.
Yep, yeah.
So
So that's how.
immediately, right after that first
Yeah,
treatment that we
Yeah,
apply,
yeah,
yeah,
they can see an immediate result, which is
yeah.
incredible. And
It
it actually gives them like a wow factor. Like, wow,
yeah, yeah.
yeah.
I had this pain for months, for years, and nothing made it go away. And it's
Yeah.
almost like incredible. Yeah.
It's miraculous, I think. Yeah.
Yeah, yeah, it really is. I love all this stuff. So it's interesting because so I have a similar mindset as both of you, and I like even you guys have a very similar mindset and perspective. Like I want to keep all my original equipment. I'm
Mhm.
all about being natural, and I'm also really into devices. I've worked with a lot of different devices and technology. I've got some videos talking about various things, and so the Softwave was, or and still is, exciting for me too. So it's really nice for me to get that firsthand because now I'm in the office here, and I'm watching these people, experiencing it and walking out.
Hmm.
So it's really cool. It's good to see.
Yeah.
Yeah, yeah, it's just it's nice to even just like I said to see the same mindset.
Like Dr. Diego said, it's a game changer.
Mm,
Yesterday morning, I had a number of patients. The first one I had was a knee patient, and she was excited because now she can ride her horse. The second patient that
mm,
came in was a shoulder patient, and she's excited because now she can play pickleball. The third patient was a knee patient. She was excited that she can now go to Hawaii and enjoy herself rather than having to limp around. Um, I got a guy today, he's just signed up. He's a knee patient again, and he's excited that he can do his job and work without pain. So yeah, we get those kind of stories every single day, and
yeah,
that's what gets me out of bed in the morning. My passion has always been, even with just chiropractic in there, and my passion has always been to help patients get out of pain without drugs or surgery.
right, nice. And
Absolutely.
you're continuing to do that a little bit far from here. You're a few hours away from us
At
now.
3.5 hours south, in Carlisle, Pennsylvania, about a half hour south of Hershey. And as I tell my patients, the reason why I'm here is because my daughter went to Messiah College, which is in the local area here. She went to Messiah College when we lived in New York. She met a guy, got married, they bought a house, and then they had a kid. And then my wife said, "We got to move." And so,
Wow.
that's why we're here. And I've been in my office in Carlisle, Carlisle Pain Relief. I've been there since November. Um, it's my part-time, keep myself in the mix and stay out of trouble practice. I love it. It's been wonderful.
Nice, nice. And you are going to continue to come and visit us out here once in a while,
If you're
right?
lucky.
We're gonna get the
Yeah, I still
cameo appearances.
cameo
Yeah.
appearance. I still have friends and whatnot there, and so yeah, I'll be there.
Nice, nice. Yeah, I'm looking forward to just even to be able to converse with you. It's nice to be able to tap into all your experience. Um,
Thank you.
and you know all. I mean, you know so many people too. So yeah,
Hmm.
I appreciate being connected to both of you guys.
Yeah, I'll
It's pretty
continue
cool.
to post videos and stuff on the Facebook page just to stay connected, if
Nice.
that's okay with you guys.
Oh yeah, and 100%. In fact,
Oh, we'll
so
love it.
we've been recording. So Diego and I have been recording, but I wanted to wait until we put this video out first, and then we'll start also adding up. This way, they can see us all together.
Mhm.
Because I know you've been great at putting stuff out there, content, and yeah, we're eager to.
Content is king. I tell you what, if you put stuff
Yeah,
out there, it attracts attention, and
right,
um, there's nothing like social media advertising. I mean, when I first started, it was the yellow pages,
right.
and then we were doing print ads. It was a time where I almost got into television, but that became a little too
Mm,
costly. And I said, you know what? But I did radio too. I was on the radio. We did some of that stuff for a while. Um, but nothing has as great an impact, in my opinion, as social media.
right, right. It makes it possible for all of us to connect. Yeah, get people's attention, make them
Wow.
aware, educate, etc. Very
Yep.
nice. Yeah, we'll be getting Dr. Diego out in social media a lot more. Gotta let the world know
Yeah,
about him.
yeah.
Absolutely.
We have good content now. We just gotta upload them.
Yeah, yeah,
Um,
exactly. Yeah, we
Good.
have you have so many happy, satisfied clients that are walking through the door every
But
week.
it's gotta be consistent. You gotta put stuff out there on a regular basis, at least a
Right,
couple times a week, in my opinion.
right. Oh yeah, absolutely. Yeah, so we'll try to stay on top of that. Of course, we're going through this transition now, which is going to be taking a lot of time as
Yep.
we
Yeah.
work to transition Diego more into the spotlight over here.
Hmm.
Right. Very good, very good.
Yeah, that's good stuff.
Yeah. Well, awesome. Well, yeah, thank you. It's really good to speak with both of you. And what else? Is there anything else? Did you want to add anything else, Diego? Or I'll have the information about the
Mm.
address, the physical location, the website, and all that for the center here in Middletown, and as well as your place where you're at too, Dr. Holtz. So definitely we'll continue to like do cross referrals and stuff, and
Yeah, that'd be great.
yeah,
Yeah.
so it'll be
Yeah.
nice.
no,
And
it's good.
yeah, right, all good. All
But
right,
that's
yeah.
that's the machine right there behind Dr. Diego. That's the
Oh yeah,
Softwave machine. That
yes.
is the power. And you know what? I printed up my shirt here. I got a Softwave.
Nice, I see it.
But what's powerful here is, where is it? There it is. That's the waveform. Where is it? I keep.
Right, right.
That's the waveform that's created by the soft wave impulse. It creates a positive
Mm,
pressure and then an immediate negative pressure. That's the magic. That's what
yeah.
creates the vacillatory effect. That's what makes the cells create a healing response. And
Mm,
I use that image all the time, and patients get it when they see that. That's what sells them on the in addition to feeling that
right,
immediate change when they get off the
right.
table from their first visit.
Mm.
I had a patient this morning, and
Uh-oh, it's froze.
Oh, he
she was in the
froze.
building that I'm in,
Oh,
and I was coming down the stairs. And when I was coming down the stairs from the upstairs restroom, I saw her, and she's rubbing her knee, and she was there for another provider in the building. I said, well, "What's going on with your knee?" And so I just had a conversation with her, because I felt like I could potentially help her. And this was about a month or so ago, but she came in today. She came in today as a new patient,
nice.
and we did her therapy, the soft wave on her, and she got up off the table and she said, "Well, I think it's hurting a little bit here. I think I can move a little bit better. I think I can do this. I'm not sure." Um, and then she went to sit down in the chair she was sitting in next to my desk, and she had a like, "Holy look at that! I could sit down." And then she stood up. "Oh, I can stand up." And so she did that
Wow,
sitting down and standing up. She said, "Oh my goodness," she said, "I've not been able to do that without help and support for months." And
wow.
so that's the aha moment that patients often get when they don't feel it right away. When they go up, yeah, it feels okay, but I'm not sure. And then they go through their activities of daily living, and then they
Mm.
feel an improvement. And right there, she was sold, and she signed up for care, and I'm happy as a lark to be able to help her.
Oh, it's so nice. Yeah, I hope we'll be capturing some stories like that on video here. And of course, it's difficult because, not everyone wants to be in the public eye and we have to protect their privacy. I mean, we're obligated by HIPAA, et cetera. But
Yeah.
it is nice when people offer like, yeah, put and in fact, we already have one guy recorded. He was more than excited to be on video.
Yeah,
Um,
well, if I know who you're talking about, he's just a ham. Great guy, but he's a ham. He likes to be on
yeah,
camera.
I'll be looking for more hams. So we got to get those people out there,
They're
right?
out there. I tell you what. I mean,
Yeah.
I got the my pickleball lady. Um, she did a live Facebook testimonial with me,
Nice,
and then
nice.
she
Yeah.
came in the next time, the very next visit, her very next visit. She came in. I said, Kathy, you got to do me another favor. She says, what? I said, I'm redoing the ads for my social media, and I need new models to. Oh yeah, you can take me. So I did some video of me doing the treatment on her shoulder.
Nice.
Yeah, so patients oftentimes, for a while there, I thought, I had to bribe them in some way, shape, or form.
Mhm.
Um,
Mm.
but patients oftentimes love to be able to help others by telling their story. And that's what
Yeah,
it is. They're just, helping their helping other people to learn more about what software, the power of software. It's
right.
it's it's great. Yeah.
Right. Yeah, yeah, absolutely. I'll be doing some technical videos on it too, because I have a lot of technical videos where I talk about potential of ultrasound, et cetera, all kinds of different frequency healing, and I'll do more stuff. I'll get that Softwave logo out there a little bit
Gotta
more.
remember, Victor, that the sizzle sells, not the
Yeah.
so it's the feeling, the emotion. How did you can tell them all you want. I mean, I go through a thing about angiogenesis and how it
Mm,
increases blood flow and stem cell activation. Stem cells and that is a hot word nowadays, um,
right.
but it's the how does it make you feel?
Right.
What is it that you do in everyday life that you can't do now that you would love to do again? What is that? What is that? Playing with the kids, playing with your grandkids,
Mm,
and so when I do that consultation, I try to get that information. What is it that you miss not being able to do? And then right before the therapy, I said, "Well, are you ready to feel good again? Are you ready
yeah,
to get down on the floor with your grandkids again? Let's see how this works for you. Come on up on the table. Let's try it."
that's awesome.
So keep that sizzle, keep that excitement by
Right.
helping them to appreciate um, what they're missing and how we can change their life again.
Yeah, absolutely right. It's all about quality of life and the storytelling. Let have people get their
Yeah.
stories out there.
Yep.
Yeah, very cool. Well, thank you for sharing some of your
Sure.
story with us. That's pretty awesome. Yeah,
Yeah,
very
my
good.
pleasure. I'm happy to. I guess I'm a
Cool.
hand too.
Well, we'll see if we can take advantage of you more in the future. We'll have to do some more videos
Yeah,
together.
absolutely. That'd be fine. No matter when it is, let me know, and I'll gladly hop on with you guys and make it work.
Cool.
Awesome.
And
Thanks for the
again,
help, Dr. Holst.
I
Appreciate it.
can. Yeah, I can. Maybe we can do one time. We can do it from my office here in Pennsylvania.
Nice
A
idea.
tiny little room, but I get it done.
Yes, and
Nice.
we could probably like go over the machine, show it,
Yep.
show the sparks.
Yeah. Well, I
Um,
don't know about that. I don't know if I told you about this, but at one point during my experience there, I thought it would be just great to push the button once and allow it to pop once. Um, and I did it for a few times, and patients were, excited but then I had one patient who saw that and she jumped, and
Oh, it
I'm
scared
telling you,
her.
she literally said, "Can I change my mind?"
oh wow.
Oh, wow.
And she
Yeah,
she she opted out. She did not want to do it.
yeah, I
Wow.
guess yeah.
I said, I don't know what you saw, what you think you saw, what you think you're going to feel. Um, but it was just an energy that you saw that you're going to feel. No, nope, I don't want to do it.
No.
and they had
Wow.
been a she her 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 husband had been a patient for years, and she heard about the Softwave through him, and yeah, she opted out.
I can understand. I mean, some people are afraid of technology or sound or to see something like that. I can understand. Maybe
So
I have to do an emotion code session on.
yeah, so from that point on, I stopped popping it. I stopped showing them the spark.
Gotcha.
Um,
Mm,
Okay, that's
that's
some
good to
that's
know.
yeah,
yeah. I was just gonna say that. I was just gonna, I was gonna add too. I think it's really important. It's not only the tool, but it's the practitioner. So, and so, like, I know that the two of you are very popular. Like the clients really actually like going to see you guys personally, not just to go see any chiropractor, right? People get their favorites, and I think from the little I know of both of you, you both seem to be, kind of more gentle and more. I don't know if gentle is maybe the right word. Uh,
sincere is a good word.
okay, yeah, sincere, right? Yeah, like
Mm,
really genuinely focused on what's going on with the client. And so I think your handling of the device, because I mean, you could take the same device and you put it in my hands. First of all, I don't know what I'm doing. And I'm not really, I don't want to touch people. I'm a wellness practitioner, but I'm doing things where I don't have to touch anybody, right? So I think, you want to go to a practitioner that, of course, has some experience, proven experience, is very comfortable in dealing with people, is sincere, right? So they're genuinely connected and trying to understand what's going on with the client.
Yeah,
And I
well,
know, like, even speaking with Dr. Diego, the way he's explained to me how, like the idea of judging like the level of response from the person and all that. So I appreciate that it really does make a difference to choose a practitioner that cares and knows what they're doing and has some experience, etc. So
yeah, I sincerely want to help patients get well,
mm,
and I do my best to have them appreciate that.
mm. Yeah, I mean, I feel you guys are a couple of gentle souls, I think. Yeah, so it's nice. Yeah. All right, yeah. So thanks again. I guess that's probably we're probably at a good stopping point. Um, we had lost you for about a split second. Your screen froze, but I'll chop out
Oh
that
yeah,
little delay. Yeah, but we
Which
didn't
one?
lose any of your words, so that was good. Yeah,
mm,
I think it's all good.
All
okay,
right,
Um,
perfect.
I'll have all the contact information down below, and looking forward to doing more stuff together.
yeah,
Same.
awesome.
Good to
Excellent,
see you,
excellent.
Dr. Holst.
All right, guys, we'll see you in the office next Monday.
Oh,
Perfect.
excellent. I got to get this video out before then so that people will know you're coming.
There you go. Awesome.
Very
All
good.
right.
All
Very
right.
cool. All right,
All right.
guys.
Fantastic.
Take
Have a great
care.
rest of your week. Good weekend.
Yeah, thank you. You too.